Guys, please stop stretching out your sciatica. I see this all the time with people with new acute sciatic pain. They want to make it better, so they overstretch the hamstrings, they massively stretch the hips and the glutes, and I found that people might be making their symptoms worse. In today's video, I'm going to teach you my 3-step system, my 3 easy to implement exercises that you can start right away to start making a big impact on your sciatica. Hi, my name's Mike and I'm a physio based here in the UK. And if you're new here, welcome back to my channel where we talk about all things physiotherapy, injury rehab, fitness, aging gracefully, and sometimes my love of coffee. And today we're talking sciatic pain. So quickly, let's run through what sciatica is. And it's an irritation of the nerve which runs from your lower back down through your bottom, down the back of your legs or leg to your foot. And it's generally caused by a small herniated disc. That's a small bulge in the disc irritating the nerve. It can be caused by some tight muscles as well, and it can also be caused by some bony parts in your back, bony osteophytes just irritating the nerve as it passes by. And it's characterized by pain and pins and needles or tingling in the leg, glute, or lower back. Okay, so good news, most sciatic pain resolves, generally resolves within 12 weeks, but if we can get on top of it and do some good work, we can often make a big inroads into helping it resolve a lot quicker. I've seen patients that they're doing their best to manage sciatic pain, massively stretching their hamstrings, massively stretching their gluteals, and in theory it makes sense, but when your sciatic pain is really acute and painful, doing those things might actually be prolonging your agony. And today we're going to talk about how best to manage that. As I said at the start of the video, these 3-step system that I give to most of my patients, it's really successful and it's helped hundreds of people. It can help you too. So how do you know that you actually have sciatic pain? This is the best test that you can do at home to see if you have sciatica or if it's something else. So in sitting in this position here, sat on the edge of a chair, for example, the first thing that you need to do is to try and see if the sciatic pain is the issue, is just to drop your chin down onto your chest. Okay, and hold it there for a few seconds. Does that reproduce your symptoms of sciatic pain? Are you getting glute pain or pain that transfers down your leg? It could also be tingling sensation as well that's brought on by this. If it is, the chances are you have sciatica and quite irritable in nature as well, because this is a fairly simple test. The second thing to add on to that though, if that's not reproducing your symptoms, is in the same position, I want you to straighten your leg out in front of you, bring your toes towards you. Hold that for a few seconds and then relax down. Now, often with sciatic pain, that position there tensions the nerve, it puts it on a stretch, and that's enough to reproduce your symptoms. So again, if that produces some of your symptoms, chances are that you're dealing with sciatic pain. And the third thing, if you've tried both those things and it's not reproducing any of your symptoms, the third thing you could try is to combine the two. So you drop your chin down onto your chest, and then at the same time you extend the leg, toes towards you. Again, if that reproduces your symptoms, the chances are you have sciatica, and this video is absolutely for you. So you've tried those tests and we think you have sciatic pain. These are the 3 steps to make it better, to shorten that time of recovery so that you start getting better a lot quicker. Please don't overstretch your hamstrings or your glutes when you're in the first stages of sciatic pain. You'll make your symptoms worse. It's too much for the nerve to cope with, and actually you'll prolong your agony. So instead, the first exercise that I want you to do is a nerve floss, a nerve glide. Just its name sounds nice. We're just gently gliding and flossing the nerve rather than tensioning it into a sharp stretch. Remember, the nerve is probably angry, inflamed. It doesn't want to be tightened up. It doesn't want to be stretched. It wants to be treated with a bit of love and respect, and we're going to give it a little glide. So let me show you how to do it. You need to do this on a firmer surface if you can. So either on the floor, I mean, I've got a treatment couch here. You can do it on your bed if you struggle to get on and off the floor, and you will get benefit from doing that. So don't let that put you off. So lying on your back here, we're assuming that my sciatica is in my left leg, the leg closest to the camera. You're just going to hold on to the back of the knee, and you're just going to pull it towards you very slightly. And what this does is it just takes the tension out of your hamstring a tiny bit. Here's the movement, lifting the leg and bring it back down. You'll see that I'm not holding the stretch at the top. As soon as I feel any discomfort, I'm chickening out and I'm just bringing that heel down. The sciatic nerve loves this exercise. It's a lovely glide. It's like taking a feather duster to the nerve and just gently giving it some TLC. So as you get a bit better with this, even during the first set, you might notice that actually, oh, this is moving a bit further. I can just lift my foot up a tiny bit higher. And that's because the nerve's responding to the movement. I would suggest that you do between 20 and 30 repetitions initially, if your pain allows. If it doesn't, or if you find that you're just caught down here, that's also fine. Just try and glide through this range of motion here for as many reps as is comfortable. And remember, we're just trying to challenge the discomfort. We're not trying to fight against it. Okay, so 20 to 30 reps, have a small break, do another 20 to 30 reps, so 2 sets. So the second exercise that will make your sciatic pain better, and it's in combination, these 3 need to be done together, but your second exercise is assuming that the cause of your issue might be because you have a small disc pushing on the sciatic nerve, recreating your symptoms. But even if it isn't, this is a nice mobilizer for the muscles in your back, your glutes, your hamstrings, and it helps produce some blood flow to help nourish the nerve as well. So it's well worth doing. Let me show you how to do it. So again, it's the same setup. You need a firm surface, either the floor, treatment couch, or a bed. Best done on a firmer surface if you can tolerate it. Let me show you. Okay, so lumbar extension is that exercise really, and it helps the disc material just to be assimilated back into the spine a little bit. And again, as I mentioned before, good blood supply, muscle relaxer, etc., mobilizer of your lumbar spine. It's a great exercise to do. You'll notice, I don't know if you were counting along with me there, but I held the initial position for about 3 to 5 seconds. I came up gently onto my forearms and held it for about the same length of time, 3 to 5 seconds. Now we can modify this to keep it aligned with your sensitivity of your nerve. So you might start with 1 or 2 seconds to start with. And even if you can't come up onto your elbows at all, lying on your tummy in that position is often a great relaxer for any disc material that you might have, and the sciatic nerve tends to like it as well. So that's exercise number 2. In terms of how many to do, I would suggest, if you can, doing about 10. So you come up onto your elbows initially and then relaxing back down. So we're talking about acute sciatic pain here, but if that's easy and you're finding that's nice and comfortable to do and you have an extra range of motion, you can just push up a bit higher onto your hands. But for now, we just keep it onto our elbows to manage the acute nature of your sciatic pain. So the final exercise of the holy trinity of my treatment plan for acute sciatic pain is a hip mobilizer. Again, let me show you how to do it. Firmer surface is best. You can get away with it on your bed if you need to. So in this position here, I'm trying to keep my back straight, my tummy drawn in slightly, and my head in neutral. So I'm not dropping my head here because that might actually make your nerve worse, and I'm not lifting it up here either. Now from this position, you just widen your knees slightly, got a wider base. Here's the movement. Drop your hips back and then bring it forwards. You'll notice I'm not holding the position. I'm not holding it. I'm mobilizing out of the position straight away. So we're stretching the muscles, but we're not tensioning the nerve. Stretching the muscles and not tensioning the nerve. So you can see that I'm using a very short range of motion here, but if your pain or your range of motion allows, you can go down a bit deeper and then come back again. Down a bit deeper and then come back again. I suggest you do 10 repetitions, have a short break, and then you might want to do a second set. So just to recap, the 3 exercises that I want you to do are a sciatic glide, beautiful, one of my favorite exercises to do. The second exercise that I want you to do is a lumbar extension coming up onto your elbows. And the third option, or the third exercise, sorry, it's not an option, is the hip mobilizer, the hip opener. So that's my 3-step system to managing sciatic pain. It's really effective, so give it a try straight away. If you found value from this video, because I'm a new channel, I really appreciate it if you could like the video, which shows me if this content is the kind of thing you're looking for, and subscribe if you want more content like this. But in the meantime, thanks very much for watching, and I look forward to seeing you in the next video.